Right now, if you have hearing aids, they are not covered under Medicare. However, lawmakers, including Chuck Schumer and Bernie Sanders, are pushing to expand Medicare coverage for seniors to not only add hearing loss coverage, but also dental and vision as well. I found out how it would work for you. Joining me now is Max Richmond from the National Committee to Preserve Social Security and Medicare. Max, thank you for the time.
Well, thank you for inviting me. Appreciate it.
So we saw some similar bills in Congress last session. What is currently being proposed?
There's a lot of discussion about formulating legislation that would address gaps in the Medicare program. Medicare is a great program. I've never met a single Medicare beneficiary who isn't thrilled to be on Medicare. But there are serious gaps that need to be addressed. Vision, dental, and hearing are not covered by the Medicare program. And, I've done hundreds of town hall meetings around the country over the years, mostly with members of Congress. Most people believe that they're going to have coverage for hearing, dental, and vision when they reach Medicare eligibility. And they're shocked to find out that they don't, and that needs to be addressed. When that was passed into law in 2003, I was in the gallery of the House of Representatives until about 2 in the morning. I left to go home. By the time I woke up at 6 or 7 in the morning, a deal had been concocted that prohibited the government from negotiating for the best price. I think it's very important that Senator Sanders, who's been a champion for these issues for so many years, finally has convinced the leadership. Senator Schumer had a press conference a few days ago where he talked about the need to improve Medicare by adding dental, vision, and hearing.
So what about adjusting additional benefits to low-income Medicare and Medicaid recipients? Will lawmakers be pushing for that?
I hope so. It's another one of our priorities. The fact that those individuals suffer greatly because they don't have that coverage, all of the problems related to the increase in benefits that I mentioned are even accentuated in those populations. 10,000 people turn 65 and become eligible for Medicare every day. And we need to make sure that they remain as healthy for as long as possible. And these benefits, hearing, dental, and vision, I know some members of Congress may consider these luxuries. If you need to see a dentist, if you can't see properly, if you can't hear alarms, it's not a luxury.
So according to the Tax Policy Center, the U.S. spent $644 billion on Medicare. Would this add to the price tag, or are you reappropriating some funding?
The connection, very important connection between the cost of prescription drugs and the inability of the government to negotiate for the best price. If we can change the law, and I think we're close, to not just allow, but to mandate the government to negotiate for the prescription drugs, the savings, we've been told by Congressional Budget Office, would be over $400 billion for 10 years. That money should be designated to improve benefits.
What are the prospects for this legislation?
I think better than ever. We have a Congress that has a majority. The Democrats have been pushing this for years. We have a president who is supportive. It's a perfect storm to finally get additional benefits added to Medicare. Medicare has changed over time in a positive way, and this would be a big step forward in further improvements.
Max Richmond, thank you so much for your time again.
Thank you for having me.